So the symptoms for COVID-19 are things like fever, cough, shortness of breath. Those are the most common ones that people with COVID-19 are complaining about. But we also hear people complaining about things like sore throat, runny nose, body aches, very similar to how the flu presents. In order for us to be really worried about somebody who has COVID-19 and is really severely ill, we would see things like fever greater than 100.4, bluishness to your lips or your fingers. Shortness of breath is really key. We've noticed people with mild symptoms tend to not have much shortness of breath, but those who do have pretty profound shortness of breath. There is a lot of overlap with symptoms for people who have allergies, flu, a common cold, or COVID-19, and that's what's made it really difficult for us to contain the virus. Most people with allergies, and this is the time of year when we start to see them, are experiencing things like they're not having fever, or they might just have a scratchy throat and a clear runny nose and no body aches would be more of an allergy kind of response. But flu, common cold, and COVID-19, a lot of overlap. And again, that's why we encourage people, especially with mild symptoms, to just call your doctor and we can help guide you through what you may be having and where the appropriate place is for you to go. The tricky part about COVID-19 is many times people can be exposed to it and then not exhibit symptoms for many, many days. I think the most responsible thing to do is to self-quarantine if you are pretty sure that you were exposed to someone. But again, as we've said, be very careful about your symptoms and report any worsening symptoms. Or if you're just having trouble understanding, is this something that should be evaluated, call your doctor's office to have guidance.